So, hello everyone. My name is Tim Roberts. I am the Managing Director of an organisation called Thrive Tribe, and I'd like to give you a huge welcome to our first ever Thrive Tribe Talks session, which today we're joined by Thrive Tribe's lead GP, Dr. Richard Pyle. Hello, Richard, and welcome.
Hi, Tim.
Plenty more from Richard in a minute, but just first of all, just to alert you that the session today is being recorded. And as a result, you've all been put on mute and your cameras have been turned off. So best to keep it that way so that there's privacy for everyone. Well, first of all, before we crack on with the webinar, just a little bit of an intro about Thrive Tribe. Some of you might not have heard of us before. Thrive Tribe is a provider of various healthy lifestyle services, programs and products. And we do that in different parts of the country under different guises. So some of you today might have come through a particular service that we provide locally. For example, we've got, I think, people here from East Sussex, where our service is called 1U East Sussex. Lincolnshire, where we're called 1U Lincolnshire. Kensington and Chelsea, where we're called 1U Kensington and Chelsea. Westminster, where we're called 1U Westminster. Hammersmith and Fulham, where we're called Healthy Hearts. Kingston, where we're called Kick It, Stop Smoking Service. Oxfordshire, where we're called Achieve Oxfordshire. And Surrey, where we're called 1U Surrey. We're called different things in different places because we provide services for local authorities, and in each area we are branded and constructed and offer the right package of services that's needed in that area. So that explains a little bit. We do a whole lot of other things too. For example, we provide a program called Man vs. Fat, which is a nationwide football program in around 90 locations, where we're helping around 4,500 men lose weight through playing football. We also do numerous other things, but that's not the chief topic for today. But do look us up or get in touch if any of that sounds of interest to you. Right, about today. So the first half of today is going to be passing over to Dr. Richard Pyle, who's going to talk to you about lifestyle medicine from a healthcare professional's point of view. After that, everyone's going to be broken up into breakout rooms, and you're going to be in a breakout room based on the area you're from. So if you've come here today through our East Sussex service, you'll be in an East Sussex breakout room where you'll be hearing from our team members from that location. If you're not from any of our locations, a number of people here today who've joined us from other parts of the country where we don't operate, for example, you're still very, very welcome, and you will stay in the main room after the sessions from Richard, where we'll talk to you a bit more and answer any questions that you've got. Please do use the chat today. These things are always much more interesting if they're interactive, so do provide your comments, your feedback, your reactions in the chat. If you've got any questions, please also post them in the chat. If possible, we'll reply to them on the chat itself today. We've got various people lined up to help do that. If they're urgent questions, we might be able to get Richard to answer a couple, but Richard's going to be mainly in full flow delivering his presentation. Any that we don't get to today, what we're going to do is we're going to take them all off Zoom, and we're going to answer them, and we'll email them back to anyone that's attending. You'll get a full range of answers to anything that you want to ask after today. But do use the chat. That's where we're going to focus the questions. Right, cool. So that's really it from me. So I'll be around for the session, but now I'm going to pass over to Richard, who will introduce himself and start his presentation. So over to you, Richard.
Thank you, Tim. I'm just going to start sharing my screen in a moment. So welcome, everyone. I'll just start by briefly introducing myself. My name's Richard Pyle, and I'm a GP in St Albans in Hertfordshire. I've been there for 20 years. I'm a full-time partner. I work most of my week in the practice. I do a bit of time as a commissioner, a little bit of time each month with the good folk at Thrive Tribe, for which I'm the lead GP, and one or two other bits and pieces, including doing some writing that I shall shamelessly plug later on. This is going to be, it's only about 20-25 minutes, so it's going to be a bit of a whistle-stop tour through lifestyle medicine, and really, hopefully at the end of it, I hope that you will be encouraged, stimulated, maybe even challenged about how you consult and how you do that in real life. So, yeah, as I said, I've been a GP for 20 years in St Albans. I am a father of 4, husband, dog owner, runner, archer, Xbox gamer, and this picture on the side here is of me gurning outside of my surgery, having recently written Fit for Purpose, which is a book all about well-being. And so this is an area of real interest to me, and something that I've really been developing a lot over the last 5 years or so. And in my CCG, I'm also the board GP leading on well-being and prevention. So lifestyle medicine, what and why? Sometimes, and I know there's lots of people from primary care here, and some from public health, and some from community services, and presumably people from 1 or 2 other places. So I'll try and keep it as broad as I can. Sometimes when people think about the term lifestyle medicine, it does make them roll their eyes slightly. It can be seen as a slightly woolly thing. But actually, for me, lifestyle medicine is up-to-date, evidence-based, and should be core to everything that we do. And as you can see on the slide here, it deals really with, if you try to define it, with the research, prevention and treatment of disorders of non-communicable diseases caused by lifestyle factors, and then integrating lifestyle practices into the modern practice of medicine to lower those risk factors and to treat chronic disease. Now, this is a pet topic of mine. For me, modern medicine, the way that I was trained as a doctor, without lifestyle medicine, it's really a frustrating, broken, ineffective and disease-based model. That's the conclusion that I've come to over the last 20 years. And really, it's about, we end up talking to people about what's the matter with them as opposed to what matters to them. And really, until they become sick or worried, we don't deal with them particularly. And by the time, of course, that patients come to our services, by then they already have potentially become unwell or developed long-term conditions. And we can see that in the fact that life expectancy has now plateaued in many countries, is decreasing in the West. And anyone who works in primary care will know that a significant number, if not the majority, depending on the day, of the presentations that you see in primary care, the people that you see, are not really about health. Health only accounts for about 20% of our well-being, how happy we are, how satisfied we are with life. The majority of it actually happens outside of the doctor's surgery, outside of the pharmacy, outside of the hospital outpatients, in the A&E departments. And yet the problem with modern medicine is that it is a fancy, expensive and complex tool, and yet also can become very simplistic, a bit more like a hammer. And if all you've got is a hammer, then the risk is that everything can look like a nail. And we, like doctors, can be complex, expensive tools as well. And that's not always necessarily the right tool for the job. So from my perspective, lifestyle medicine really, in the practice of it, and whether you call it holistic medicine, progressive medicine, well-being, whatever you want to call it, it's core. It's not alternative. It's not woo-woo. It's not an optional extra. And that's increasingly being recognised, for example, in the emphasis on prevention nationally. And indeed, you can now have specialist training and accreditation in lifestyle medicine, such as through the British Society of Lifestyle Medicine. I did a diploma with them this year. And one of the things that people sometimes talk about is sort of evidence-based medicine and how solid that is compared to some of this slightly more touchy-feely stuff that we might do in lifestyle medicine. And it's interesting if you think about that, because if you take, for example, something we'd regard as conventional and medical, say the prescribing of statins, if you look on the NNT.com, an excellent website which looks at the numbers needed to treat for an intervention, so how many people have to have that intervention for it to benefit one of them. If you take people who are at low risk of cardiovascular disease, so that means a Q risk score or another risk score below 20% over the next 10 years, and you give them all a statin, you have to treat about 217 of them for one of them not to have a non-fatal heart attack. You have to treat over 300 of them for one of them not to have a stroke. And yet that is mainstream conventional medicine. Well, you wouldn't prescribe an antibiotic that only works 1 in 250 times. And the actual likelihood of people dying from these diseases, from heart disease, if they're low risk, is not affected at all by the prescribing of statins in any way. And yet the number of people that you need to treat with a Mediterranean diet who are moderately or severely depressed and perhaps already on medication to cure their depression or significantly improve it is just 4. And pharmaceutical companies would kill to have that kind of data available at their disposal. So that's why I think lifestyle medicine, getting back to basics, is so important. And so you'll be unsurprised to hear me say, yes, I think it is our job. I've had this discussion with my colleagues across public health and particularly across primary and secondary care. As people working in primary care, we're in a unique position as their GP or their nurse, their physio, their social prescriber, because they probably know us and we know them, and we hold the golden thread, as people like to say. We have their full medical record and we know a lot about their life. And even though we might not be the person who delivers or helps a person go through the whole lifestyle medicine and well-being journey, we can certainly be the person who starts that conversation, who asks some questions, and whom they trust. And so we can be there at the beginning. And then the question is how we hand off in the right way, which obviously is part of what all this talk is about today. The Royal College of GPs, that august body, endorses a prescribing lifestyle medicine course, which is done by my colleagues, Dr. Ayan Panja and Dr. Rangan Chatterjee, which is an excellent course and has been running for the last 2 or 3 years. So it is recognised as a GP thing. And I would ask you the question, and this is where I may get slightly passionate / preachy / challenging, so forgive me if I do, but why would we want to settle for treating symptoms when you can address the cause? It's a little bit like if someone came into our surgery and they were constantly falling over and hurting their head or their knee, we could take the approach that we just give them bandages, give them painkillers and tell them to try and be a bit more careful. But I'd like to think that probably we'd be interested in why they're falling over. And that's really what lifestyle medicine is about. It's about looking at the underlying cause. And sometimes people get a bit concerned about this because they're a bit worried that if we don't do loads of tests and loads of treatments and lots of referrals for people who present to us with things that we think actually would respond to some lifestyle medicine, the worry is maybe we'll get sued, maybe we'll be a bad doctor. But actually, that makes a big assumption. And that assumption is that practicing how we currently practice is not doing harm. And I would challenge that. Some of these investigations can be invasive and risky. We all know about the concept of incidental omas. You refer someone for a test, something is found that's entirely unrelated. And as a result of further tests and investigations, the patient is actually potentially harmed or at the very least worried. And we know that sometimes referring patients to other specialists causes the same problem. We know that many of the drugs that we prescribe are not without risks. So I would like to sort of flip that around and say that actually it is our job and it's really the best way of practicing medicine. And finally, and perhaps most provocatively, I just ask you the question, how big do you want your palliative care register to be? Because at the moment, when we talk about palliative care, we talk about people perhaps who are dying from cancer or heart failure or dementia or just frailty of old age. But actually, if you have someone sitting in front of you as a GP or a nurse or whoever, and you know that actually the reason they keep coming to see you, the reason they keep ringing up, coming to the surgery, going to A&E, taking all these medications, having all these blood tests, is really because they're unhappy with their relationships, with their job, with the place that they live, with other things that are going on in their life, and that really you should be addressing things like their sleep and their relationships, etc. If you knew that to be the truth, if they were a cancer patient who needed an urgent referral, you would never dream of just palliating them and saying, there, never mind, here's some antidepressants and painkillers and we'll just make you as comfortable as we can for what's left of your life. But in reality, that's what we're doing if we don't help people address the core issues to them. So the pillars of well-being, again, this is a gallop through. I'm not going to talk to you about every single one of these in detail because clearly most people on this call in this meeting know about these things, but the things that I talk to my patients about and I think about, even if I don't ask every single question about every single one each time I meet them, I'd be thinking about sleep, the bedrock of our health, the tide that floats all boats. It's free, it's available to everyone, and the benefits of it are tremendous, and the harms that occur as a result of being sleep deprived are also significant. And that's one of the things I talk to people about as one of the most basic aspects of their well-being. Movement. We've become increasingly immobile as a society. And sometimes patients say to me, well, look, I haven't really got time to fit exercise into my life and do physical activity. But actually, my first rule of movement, as I talk to patients about, is that we are all made to move and that movement is actually our natural state. And if we confine ourselves and make ourselves sit down and become immobile, actually, you know what that feels like. You become restless, you become uncomfortable, and you have to get up and move around. And so putting movement back in its place is always a really important conversation to have with ourselves and with patients as well. And I don't know if you know this, but just standing for 2 hours a day decreases your risk of dying from any cause by 10%. And again, you'll probably some of your patients may be taking drugs every day that don't even work that well. And yet just by standing up, which requires no special training for any of us over the age of 1, by and large, can make a real difference to our lives. Nutrition, again, a potentially complex and very fraught area. You only need to dip into social media to see how horrible people can be to each other about this. But I would say the conversations I have with patients are really about eating food, mainly plants, not too much. Not my words, those are the words of Michael Pollan, who wrote for the New York Times. I'm not saying you have to be a vegetarian or a vegan, but we could probably all do with having a bit more plant-based food in our diets, which is antioxidant and therefore anti-inflammatory, and getting the protein that we need from sort of savouring our food. We might call it condiments rather than condiments. So a little bit of protein in there with it to give us what we need. Relaxation and stress, really important for all of us in primary care. So many of our consultations are all about that. And I've heard other health and well-being people talk about, the problem was it used to be a lion that's trying to kill you and now it's your life. We can probably all sympathise with that in lockdown. And again, a fight or flight reaction in the acute and short term is an appropriate physiological response, which is necessary for our survival, speaking from an evolutionary perspective. But chronic low level or even high level stress and that fight or flight response is pro-inflammatory and may well be the common soil for many of the non-communicable diseases that we suffer from, like heart disease, cancer, diabetes, depression, and dementia. So it's important to cover that with our patients as well, and particularly looking at how they might find things in their life to help them to relax and unwind. And then connection. I think actually these last two are probably the most important. No man is an island, as the quote goes. We're tribal animals, we're social animals. We all need people to different degrees, but for someone to say they don't need people is really just the same as someone who has a small appetite saying they don't need food. And this huge experiment we've conducted in the last 12 months on ourselves with social isolation has demonstrated to us just how damaging that is and how we do need people and connections in our lives. And it's one of the commonest themes across the blue zones in terms of the secrets to longevity, these 5 places in the world where people live a very long time. One of those common themes is community and connection, people having a place that they belong to. And purpose and meaning in life. I'm getting slightly deep here. I don't know whether some of you consider it's the job of a doctor to ask a patient, well, what's it all about then? Why are we here? What's your purpose in life? But actually, many of my patients who really struggle, who have no apparent disadvantage physically, have had good upbringings, happy childhoods, they're affluent, they don't have any long-term conditions, they can still really struggle with life and depression. I've had people in tears saying they feel even worse because they don't know why they feel like this. And the answer often is they lack purpose and meaning in their lives. And we don't have time to go into it today, but I recommend you Google the word ikigai, which is a Japanese term, which essentially means reason for being. And helping people to think about that can be the first steps on the road to improving their well-being. So how do we do it in a consultation? Checking my time. Yeah. We need to take a pragmatic approach. You need to be ruthlessly efficient. If you're going to give more time to some people, then you need to give less time to others, because you're sitting there thinking, well, thanks for telling me all of this, but how do I do this in 10, 15 minutes? So, some of your consultations will clearly be very simple. One of my colleagues once said to me, Richard, there's no such thing as a simple consultation. And actually there is. We don't get as many of them in lockdown, but we do have some. Identify the people who are in a place where their underlying problem is the need to change, and perhaps are in a place where they're willing to contemplate it, and give those people a little bit more time that you can reclaim from simpler consultations. Be brave. Sensing this and talking to them about their well-being instead of just referring them off to the gastroenterologist and prescribing them mebeverin does take courage to do the first few times. But when you begin to get patients coming back who have clearly been really helped and helped themselves, it's very encouraging. And be prepared to challenge people. If you feel that they're stuck in a disease-based model where they're very passively coming to you and saying, I'm broken, now fix me, if that's not the right answer, in a gentle way, be prepared to push back. When you talk about changes, do it in bite-sized chunks. The principles of behaviour change tell us small, simple, sustainable changes. So they're more likely to achieve it, which means they'll be encouraged, which means they might go the next step and the next step after that. And part of that is really helping your patients to therefore take responsibility just for those 1 or 2 small things, and putting a plan down, whether it's written down or an electronic thing, depending on how much time you've got. We know that if you make a plan, it's more likely to happen. If your patient is pre-contemplative and they've stepped into the surgery, their agenda is completely different from yours, and you know maybe you're not going to get there today, well, at least at some point in the consultation, you could have asked them, I've noticed that you're carrying a bit of extra weight. Is that something that you would like help with? Have you ever thought about quitting smoking? Would you like us to support you? Could I refer you to the social prescriber, because you just mentioned that you're really stressed and struggling with your finances at the moment? And even if they don't take you up on it there and then, hopefully that will be something that they might come back to. And it's all really about signposting and follow-up, which is where organizations like Thrive Tribe come in. So yes, it's our job perhaps to introduce the conversation, but we may not necessarily be the person that takes a patient or a client all the way through the journey. So the follow-up could be in primary care, but it could be with a social prescriber. All PCNs now have them. It could be in the voluntary sector, other third-party providers like Thrive Tribe. If a person needs help with their weight, with their smoking cessation, with their mental health, with depending on which part of the country you live in, Thrive Tribe has different services, you'll be able to refer them on to that service, and that's the start of the conversation. And book a follow-up and a longer appointment if you need it. It's a good return on investment. You'd probably give a double appointment to someone who had been diagnosed with cancer. So why wouldn't you give a double appointment to someone who's significantly depressed, or perhaps just been diagnosed with pre-diabetes and needs to make some changes to their life? And lastly, I would say be kind to yourself as well as your patients. You won't get this all right every time. You can't fit everything in every day. But if you can practice what you preach, then that will stand you in good stead. I'm very quickly whizzing through the last slide. This was just my thoughts about, if you're going to practice lifestyle medicine, how do you do that in a meaningful way, which is authentic? And you might want to think about how you look after yourself, putting on your own oxygen mask first. Are you getting enough sleep? Are you going to bed early enough to get that sleep? What's your day like? How much do you walk before, during, after surgery? Have you thought about standing desks, community activities, friendly competition amongst staff? What sort of food you get in the practice? Is it the usual rubbish delivered by well-meaning patients? Have you thought about whether you could get some nicer, sort of better food that everyone could enjoy? Relaxation and mindfulness is talked about a lot. It's particularly important at the moment, and you could think about how you can reduce stress together as a practice, whether you have a social media policy to get people off their phones in the day, which would both make them more productive and prevent them from spiraling down into the rabbit hole of social media. And think about connection. I know this has been very difficult for the last year, but we're now coming back together and being able to meet more face to face, and we shouldn't underestimate the value of that. And finally, just remind yourself, what it's all about. What are your values? What are your team's values? Is the way that you practice medicine, is the way that your practice, your organization practices medicine consistent with that? And that's it from me. My book, Fit for Purpose, is out as of tomorrow. It was out as of yesterday on Audible and Kindle. There's various links on here if you're interested in following them, including to the Thrive Tribe website as well. And that's me. Thank you very much.
Good afternoon and welcome to the Achieve Oxfordshire overview as part of this webinar. My name is Mia. I'm the Marketing and Partnership Manager for Achieve Oxfordshire. So today we'll be just giving a brief overview about our services, referrals, programs, eligibility, and most importantly, how to increase referrals onto our service. So for those who aren't familiar with Achieve, I'm just going to give a very brief overview of our services, a little bit about our organisation as well. So Achieve Oxfordshire is the free weight management service for adults in Oxfordshire. We are commissioned by Oxfordshire County Council. We provide healthy weight loss through education, good nutrition and physical activity, and our courses run between 12 to 14 weeks in length. So why Achieve Oxfordshire? Why opt for us? Well, we are based in Oxfordshire. We work with local communities, other stop services like stop smoking, stop drinking services, to have a really integrated approach with our referral pathways. We take a very person-centered approach, meaning that we want to support everyone who comes onto our program to find a suitable sort of weight loss course for them that kind of matches their requirements and needs. We have a comprehensive selection of weight loss programs. We offer support for people when English is not their first language. At the moment, we're currently translating a lot of our resources, and we're also looking to offer a interpreter service for at triage level and also on our Rate with Achieve course. We'll be providing further information about that later on. Signposting onto other local services. We're always looking to adapt and improve our services from feedback from our clients, which kind of follows on from the 6 to 12 months sort of checkups that we provide once somebody has done one of our courses. So we have a dedicated BAME pilot. So like I said, like I mentioned earlier, we are looking to translate our resources into some of the most common languages spoken in Oxfordshire. We recently worked with Oxfordshire University Hospital to run a BAME pilot with their BAME network, which was hugely successful. We looked to see how we could adapt content to, so it was more suitable regards to any cultural, religious beliefs, particularly like in the moment, recently it's Ramadan. And we're again looking at how we can develop resources for that are really appropriate and usable. We're aiming to deliver another BAME pilot with Banbury Mosque. Again, that will be working more face-to-face, and that should be coming in the next couple of months. We are doing a lot of work around this area. As I mentioned, we are a very focused organisation, person-centred organisation, and accessibility really is woven into the heart of us. That we want everyone throughout Oxfordshire to be able to use our services, regardless of, their religious backgrounds, ethnicity, and all manner of things. So at the heart of our organisation is our team. We have some highly trained, capable individuals who have experience and knowledge, having worked in nutrition, physical activity, and psychology. All their expertise and knowledge is very much incorporated in how we adapt our content, and we get feedback from them, and we want to make everything as easy and relevant as possible for our clients. We very much incorporate our 3 core pillars, which is move more, be kind, and eat well, which is looking at the whole person, a real holistic approach to healthcare, which follows on really nicely again from today's talk with Richard. And so that's enough about us. There are 3 routes. Currently there's only 2 mentioned on here, but there are 3 routes in which to refer. Self-referral, which can be done on our website, which individuals can go on to fill out. Healthcare professionals can refer directly through the EMIS system, but that is only available for surgeries, the GP surgeries and practices. Also, we have a secondary referral form, which you can find under our professional section of our website, which you can fill out and then send on to our triage team. All methods trigger the same response from our triage team, that they aim to get in contact within 48 hours, and they try to talk to the individual as to match up which will be the most suitable programme. We offer ongoing, they have access to the other room gym, regular challenges on our social media, and tier 1 resources, which is our website. We also have we have loads of blog posts, podcasts, community newsletters, so there's always a wealth of information there that's very up to date, and again, great signposting onto other organisations like Mind, Samaritans, so there's lots there, and again, we are always looking to work with other groups and partnerships to establish even more connections. After the course, again, they have access to all of our resources, plus they get these 6 to 12 months follow-ups. Our programmes. So we offer 12-week vouchers for Weight Watchers and Slimming World. So these are not directly run by us, but they are a very popular offer, therefore we offer it up. I won't go into too much detail because they are, as I mentioned, quite well known, but it's often a popular choice with people coming through the referral process. So Lose Weight with Achieve. So Lose Weight with Achieve is a 12-week nutrition education course. There's a very strong focus around behavioural change, not about fad diets and things like that. It's really about educating people, looking at the whole picture approach. It includes elements of exercise as well, though that's not currently running at the moment due to sort of the recent restrictions, but it's something that we are looking to bring back shortly. I'm just about to play this video because it's a really nice overview and very briefly about what we do. You know, all of our practitioners that I've mentioned have various backgrounds, again, in psychology, and, you know, we can very much a person, you know, if somebody has a lack of confidence or, you know, comfort eating, then we can put those with our psychology lead if that is their choice. You know, just kind of meeting, you know, helping support those even whilst they're on the course with the right practitioner has been another element we've really been focusing on. So I'm just going to play this video for you.
Oxfordshire is an adult weight management programme with a difference. With a team of registered nutritionists, physical activity experts and a health psychology lead, we are able to give you the skill set required to create long-lasting, sustainable habit changes, which in turn will help you to maintain a healthy weight.
So, Swim to Slim. So, Swim to Slim takes all the best elements of the Achieve course and also incorporates swimming as the low impact exercise. People get 1 hour swimming over 10 weeks, and that's with Try Swim. It's something we're piloting at the moment in between between late May into June, and then we'll be increasing capacity as to how many people can join up from autumn. And we're really excited about this, and, you know, there's some really great benefits about swimming, and marrying them up with Lose Weight Achieve course really is a wonderful combination. Man v Fat. So Man v Fat very much it's men only. We get a lot of feedback from our male clients that they often don't feel like there is much an offer with Slimming World or Weight Watchers, you know, that the content isn't relevant, or, you know, that there's a higher percentage of women attending against those of men. So for this reason, Man v Fat football is kind of really offers them an opportunity to kind of get real peer-to-peer support. It's 14 weeks in the season. We have currently 2 leagues running in Oxfordshire, but they're looking to increase that, which is Oxford, Barton Park, and Bicester, which is hopefully launching in May. This is now all up and running since the reduction, since lockdown has now started to ease. It's really brilliant. Like I said, there's a great community with you know, men get to play football, but they also get a weigh-in before their game, and, you know, they can score points for how much weight they have lost during that week, and that then kind of contributes towards their overall score. So the biggest loser is actually the winner. And there's a lot of banter and fun, and honestly the community here is probably our strongest in comparison to any of our other programs The guys that do it really love it, and this is just a bit of video about it.
Man v Fat Football is a unique football league for overweight men that helps you lose fat and get fit, regardless of how long it's been since you last played.
Since Man v Fat, I've lost about 9.5 kilograms.
20 kilos. 10% tomorrow. 4 stone, stone and a half. 14%. 15 kilos.
20 pounds through Man versus Fat.
You can join on your own or with friends, and everyone is in the same situation as you. 95% of players are losing weight on the Man v Fat Football leagues, and 93% report health improvements.
It's good, it's sociable, it's friendly. I've made friends here that I'm going to keep for life. You'll come there, you'll play football, you'll get fit, you'll lose weight, and you have a good social life.
If you're a normal bloke who loves football, looking for a way to lose weight, head to manvfat.com/football and register now.
So next, we're going to move on to the Man v Fat Challenge, which was very much born out of lockdown. And also it's for men that don't want to play football. So it's, again, got all the great elements of Man v Fat, but it's a virtual weight loss program with still a very strong community element. Each men are put into various teams and they go against one another with challenges. So usually they have 3 challenges each week, which incorporate nutrition, exercise, and healthy habit building. They can win once they go up against one another. They also have a chance of winning prizes. Who's been the biggest loser that month or that season. They can win T-shirts. It's really great, and they also get support from a coach as well that runs up those leagues. Man v Fat Challenge. The Other Room Gym. So the Other Room Gym was also kind of came out of lockdown. It's a virtual gym, so it has full support for people of all different sort of capabilities. There's the mobility room, progression room, and the sweat room. There are 3 sessions daily that are live, but they also there's a huge on-demand content in the vault, as it's named. The exercise classes really vary. There's things like Pilates, air chair aerobatics, HIIT, so much more. And it's really great. Some people don't have time to go to a gym or work shift patterns, and so can only do things at certain times, or they may feel very self-conscious. There's so much, and this is available during and even after people have attended one of our programs. So it really is something that's really complements nicely and is really helpful for people who are trying to find inspiration or programs or want to try out different types of exercise out there. The Other Room Gym, that's all of our programs currently. So eligibility. So this is our current eligibility. So I won't go into too much detail of this here. You can find all of our information on our website, but they have to be either resident, working, or studying, or registered to a GP in the area, over 80, not pregnant, not accessed our service in the last 12 months, not accessed Slimming World or WW in the last 3 months, but they can opt for another service. Not living with complex type 2 diabetes, i.e. insulin. There is a full list of other medications, things like that, for what we determine as complex, and not suffering from an unmanaged eating disorder. So this is our BMI. I'm not going to go into again too much information about this. This is all on our website. But if you want any further information, please do get in touch about it. So how to increase referrals. So referrals, it's about having a conversation, and very follows on with what Richard has been saying today. And I'm going to play a very short video for you as to why you should engage in those conversations. Most of you will be usually very face-to-face roles. Currently, things are more sort of virtual. But you are able to speak with patients and at the moment we are moving more towards preventative sort of approach instead of just looking at treatment. And very much, even if you have a very brief conversation with somebody, it sets the seed, it starts the conversation, initiates it. And it's about creating that awareness as to what options are available for the person, and though it is sensitive, we can give you support and guidance and training around how you can have those conversations a lot more effectively, and giving you the skills and confidence to allow you to kind of be able to initiate that. But let me just play this for you now.
Raising the issue of weight with patients should always be done sensitively.
So if you're too blunt, you don't make a lot of friends. Don't be afraid to tackle the problem, because if you don't say it, no one else will.
Use something quite general. So I notice you haven't had your weight checked for a little while. Is that something you're happy for me to do for you now? Maybe using body mass index, so BMI, as a way of introducing the topic. Are there any things in terms of your health that you feel your weight is impacting on? Things that you can't do that you might like to do? Did you realise that your weight might also be affecting your blood pressure or your diabetes or your long-term health? And try and get the patient to generally describe how their weight might be affecting their lifestyle, so that they feel in a comfortable space and they feel able to talk about the things that they may need some help with. We don't want them to feel defensive. We don't want them to feel that they're being told they've got to lose weight, but to understand whether this is something that they're ready to take on, because it will mean making lots of changes to their lifestyle. Finding out why they want to lose weight, what it is they want to move towards, how it's making them feel now, so that they think positively about the advantages of them losing weight. They've probably tried before and it hasn't been successful, or they may not have ever even realised they were overweight. So I think it's important to understand and to listen to what they're saying about how their weight is affecting their lifestyle.
You don't have to solve everything by broaching the subject. You're not there to have a magic pill, but you need to know about some available options in your neighborhood. There's a lot of free services and things like that patients can actually access, which will help them, and you just get that ball rolling.
Time is always key, so it may not be the right time to raise it, and it may just be sowing the seed so that the next time they come in to see you, you can then ask them, have you had any more thoughts about how your weight might be impacting on your health? We're in it for the long game. This is long-term conditions we're hoping to improve. So sowing the seed, and then maybe the next time you see the patient, you'd be able to explore how they feel about their weight a little bit more.
So also there you might have seen that you have the knowledge base, which is a great platform that you can access through our website, the professional sections, where it has loads of these other short clips and things like that, videos that you can watch on your lunch break and things like that. That gives advice about how you can again approach the subject and various other things, which is a brilliant resource if you don't have much time. You could watch, say, in between consultations. But we can also offer you bespoke training that we can offer regarding MEC, which is making every contact count, has a focus around weight loss. So it's about having those short conversations where you can approach the subject matter of weight loss, and giving you the skill set and the confidence to be able to do that, and really so you know what to say. It's not just about signposting. It's about helping them make those small positive changes to their physical, mental health and well-being that can have a real impact in them wanting to make a difference, and just really focusing on the positives and also listening to us to what they're saying as well. We can offer up training sort of in an hour, 2 hour slots around your own availability, and there is no charge for the service. So having found out about Achieve today, it's about then how do you share that information with your clients. That's where resources come up. So we can offer up an A4 poster, A5, a variety of resources really, that you can have in your consultation room or in the waiting room, even little information cards, so that there's something that you can hand over after you've had a conversation, or if a patient just happens to want to notices it there, it's just having that information so it's accessible as possible, and that's on your website, using social media and things like that, so it's just out there and people can find it. And again, it's another great time-saving method, that if there's something already out there and somebody's already interested, they can then do further research about what we have to offer. Text messages is another great way, and we've had a lot of real success with this. There's an example here that was drafted by our psychology lead, and it's really sympathetically written, and what we suggest is that you send this out to patients every 6 to 12 months, to those that have a BMI over 30, or if they're male, they've got like a BMI over 25, they want to access our Man Feedback Challenge, and it just kind of makes them aware of what we have to offer. And we've had equivalent of maybe a year's worth of referrals in 1 or 2 days from surgeries that have used this option. We have various formats, so we can offer you something that could be sent out as an email, something could be put on social media, different amounts of characters and things like that. So do get in contact with us if you want some support in doing that. But something, a quick win that you could do for today is just sending out a text message. So that's the end of our presentation. Please do get in contact if you're interested in any training or how to have those discussions, or want more information about our programs. We are looking hopefully to be moving back to more face-to-face offer, so our information will be updated constantly. You can call us, email us, and thank you for joining us. I hope you have enjoyed today, and yes, please do get in touch if you have any questions. Thank you very much.